Judy, start.
Okay. Well, welcome everyone. My name is Judith Zelikoff. I'm a professor at the NYU School of Medicine in the Department of Environmental Medicine, and I'll be your facilitator today to bring you into a virtual community town hall meeting that's going to address by two of our leading pulmonologists, as well as a panel of environmental medicine authorities from the same department. And we'll be discussing a topic that's really important for all of us, especially in this very confusing time. And that is understanding a cold, the flu, and allergy season during COVID-19. That leads us to an introduction on the two leads that will help answer your question. Our format is such that it is mostly questions from you, from the audience, and we will only be giving some information to start with, some general information, but we're hoping, expecting lots of questions from you, things that have been puzzling you, things that are confusing you, and on this topic. So with that said, we hope we have a lot of engagement and a lot of questions because we have two leads that will be answering these questions. So our first is Dr. Forangy. If you could put on your video, great, thank you. Dr. Forangy is the Chief of Pulmonology and Critical Care Medicine. He's also a lung researcher who has a great interest in smoking-related lung injuries. He's from Downstate, SUNY Downstate Medical School, and which, as you know, is located in central Brooklyn. And he has unfortunately seen many, many patients with COVID during the early spring and March when things started going very badly. So our other lead on this will be Dr. Nolan. Dr. Nolan is, claims that she's a New Yorker through and through. And she is at the NYU Grossman School of Medicine. She's also in pulmonary and critical care. And she was closely involved in research. She's also a physician scientist. She's been involved in a lot of research in environmental exposures with a lot of emphasis and a lot of work in lung diseases associated with World Trade Center disaster. So I'm going to open it now. Let me also introduce Dr. Michael Weitzman, who is a pediatrician in the Department of Pediatrics. Dr. Weitzman, can you turn on your video? And environmental medicine. And he has been a pediatrician for many years. And has performed groundbreaking research also with tobacco smoking, as well as lead and secondhand smoke. So he is also here to answer any questions specifically associated with children. And the next person on our panel is Dr. George Thurston. Dr. Thurston is a professor in the Department of Environmental Medicine at the NYU Grossman School of Medicine. And he is an environmental epidemiologist whose research focuses on indoor and outdoor air pollution. And he will be here to answer any questions on air pollution or COVID and air pollution that you may have. So with that said, I'm going to call on Dr. Nolan to just get us started. We'll have a few questions being answered by both Dr. Forangy and Dr. Nolan. And then please feel free to write into the chat starting now. Okay, Dr. Nolan, you want to kick us off?
Hi all, how are you? I've been handed a few questions that most people might like answered, so we'll start off with those. I often get asked the following question: what is the flu? So you might ask that question because we're entering that season. It tends to last between September and maybe springtime. The flu is caused by a virus. The virus commonly occurs in our environment. And basically it can be transmitted from person to person through sneezes, other airborne type methods of transmission, similar to COVID in many ways. The incubation period of the flu is between 1 and 4 days. It's a little bit shorter than COVID. COVID's incubation tends to be between 3 days and 14 days, for example. That's often cited. Common symptoms of the flu is also commonly asked of me. And they're very similar to COVID in many ways. They include sneezing, coughing, fever. You can have some body pain. You can feel fatigued, tired quite often. You can have a sore throat. And often the flu can come with some nausea, vomiting, and abdominal pain. And sometimes even COVID can come with that symptom in particular. Another common question is, how do I know if I have the flu or allergies? Since allergies can also have very similar symptoms to early flu. Well, often people who might be having an allergy, they have a history of having allergies. So that's one thing. The other thing is it tends to come with symptoms of like itchy, watery, runny eyes. And often people with allergies can also have some skin conditions like rashes or other issues or other signs and symptoms of allergies to foods or things in their environment. Those are the first 4 questions that I have to answer. So if anybody else wants to take over and do a few more.
Okay, thank you, Dr. Nolan. Please feel free, all viewers, please feel free to write in the chat and write questions that you might have. So Dr. Forangy?
Yeah, I'm not going to run off the list, but very early on, Dr. Fauci expressed concern about the return of coronavirus in the fall. One of the reasons is, as Dr. Nolan pointed out, the lung responds to these respiratory viruses in a similar manner. So it's going to be very difficult, if not impossible, to differentiate COVID-19 from influenza, which typically causes the flu. Perhaps one factor that might be more frequently observed in COVID-19 might be the loss of sense of smell. That's been reported in a lot of patients. But it does cause a diagnostic challenge for your doctors to know what they're dealing with when patients come in with some of the symptoms that Dr. Nolan discussed. And that's one of the reasons that the public health officials are really advocating that people get their flu shot. As many of you are aware, flu shots, which work against influenza, not COVID-19, flu shots are not 100% effective. You can get a flu shot and still get the flu. However, they are effective at reducing the chance that you will get influenza infection, and they can also decrease the severity. So public health officials are encouraging us to get our flu shot. I got mine just the other day on Sunday, I think it was. In order to decrease the burden of influenza in the community and to limit the confusion that this might cause and the concern, because after what happened in March and April, people are understandably very concerned about something similar happening to them. If we're getting fewer people contracting influenza or the flu, we're going to have less of this anxiety being caused. And the flu too is a serious respiratory ailment, and people can die from the flu. So it's a smart thing to take that simple precaution and get your flu shot as well.
So we have a question. Would you say that the steps to reduce COVID, like distancing and masks, can reduce influenza this year also? Dr. Nolan?
Yes, hi. I would say yes to that. And basically, if you protect yourself from any small particles that you can inhale, and COVID-19 is a virus, as is the flu, and those things can be inhaled into your lungs. And that's the primary way of actually getting these viruses. So if you protect yourself, and you should always wear a mask, it's super important, and socially distance at all times, you should be able to reduce the risk of getting influenza and COVID-19. And in areas of the world where the flu has started already and kind of passed through those populations, and where where the populations were wearing masks and socially distancing, they did have lower incidence of flu this year. So we're hoping that can happen here too, but people really have to pay attention to their social distancing and mask wearing. Super important.
Dr. Forangy, do you want to add anything?
Sure. The studies I read said in the general public, just wearing a mask can reduce the risk of contracting this virus by up to 50%. In healthcare professionals who perhaps know how to wear a mask a little better, it actually does have to go and cover the nose. It can be even more effective. Anecdotally, I'm a pulmonologist. I have a pulmonary clinic. And, people coming to see me are coming to see me because they have respiratory viruses. So it was never in vogue for the doctor or the patient to wear a mask. And it just seemed like, particularly in the wintertime, I was sick every month with a new virus. And I can tell you that since we've had the widespread adoption and I'm wearing a mask and seeing my clinic patients every week, I haven't gotten sick. This is probably the longest stretch I've gone without getting sick. So even when COVID-19 is quote unquote over, I plan to continue to wear my mask because yes, I think it does, in clinic particularly, it does offer protection. So if you're in a high risk setting, I think it's a good idea to wear a mask. One of the reasons I think that COVID spread so quickly when it did in March and April is that, our healthcare facilities are overcrowded. We live in New York and real estate is expensive. And so we can't have expansive waiting rooms, expansive ERs. So everybody was piled on top of each other. And I believe that was a perfect breeding ground. So one way we can overcome the physical limitations of the limited amount of space that we have is to take these sensible precautions, especially when we're in high-risk settings like clinics and emergency rooms.
Okay, thank you. Dr. Weitzman or Dr. Thurston, do you have anything you'd like to add before we go on to the next question?
No, nothing right now. I think that the points were well made.
Okay, Dr. Weitzman? Okay, thank you. Okay. How effective, we've read about, and I've talked to friends of mine who have children and all, and they said, the flu vaccine doesn't seem to be very efficacious or effective or efficient at this time. So why should we even get it? So first part, how effective is the flu vaccine that we're all supposed to be getting, and why should we consider it? And I know Dr. Foranger, you addressed that, but maybe we can emphasize that a bit. So first, how effective is the new flu vaccines that's come out? And if it's a low percentage, why should we bother?
It depends. The efficacy can vary from year to year because they're really making their best guess about which strain is going to affect us because there are multiple strains that have formed over the years. And, one of the places that influenza begins is, again, in China. The vector is felt to be a pig, which can harbor these viruses and then acquire new mutations, create slightly new strains. And that's where the challenge is, figuring out what's going to be the next virus that's going to be influenza virus that's going to be affecting the world. Now, as a scientist, I can tell you that I'm a skeptical person by nature. I want to see the data. I have looked at the data for influenza, and I can reassure the audience that the data is unequivocal. Flu vaccines work. They're not 100%, but they significantly reduce the risk of contracting influenza. When they've done randomized studies in high-risk populations, they actually can improve mortality. So it's something that's always been very frustrating for me as a pulmonologist. Getting my patients, there's this real misperception out there in the public about vaccines, and it's very difficult to get them to take them. So yes, the influenza vaccine is effective. I do believe when the COVID-19 vaccine is effective based on the data I'm seeing that it'll be highly effective. Will my patients take it? That's another question.
Thank you. Dr. Nolan, do you want to add on that? And also, I just want to add that from what I'm reading, the effectiveness, and I'm playing the devil's advocate here, for the flu vaccine is about 30 to 40%. So Dr. Nolan, do you want to comment on?
Yeah, what I would say is 30, that does sound kind of low. And I think it definitely varies from year to year. And I don't know what the data is for this year's flu vaccine yet. However, 30 to 40% reduction, or if it works in that many people, that is still better than not having been vaccinated, because people can get very sick and can die of the flu. And you're not necessarily protected just because you are young or otherwise healthy from having serious complications of the flu. So I always recommend it to my patients. And I can tell you personally, I've always taken my flu vaccine, even while pregnant and even while working many, many hours and being quite tired and not feeling well. I still take my flu vaccine yearly. It is something I make sure my entire family also gets. So personally, I can tell you, I do take it, and I recommend it to all patients. Now, it's sometimes frustrating when people do not take their flu vaccine, especially if they have serious medical conditions that could put them at risk. What I would say is that anything you can do to decrease your risk of getting sick and getting hospitalized, especially this year, getting hospitalized or being in a healthcare facility where you have a higher chance of potentially getting COVID-19 because you are sick with the flu, for example, I would definitely take that vaccine and try to stay as healthy as possible, especially this year.
So following up on that, does having the flu make you more susceptible to COVID? Does it make it worse if you get it? What is the relationship in your opinion, Dr. Foranger's opinion? What is your opinion about that? The flu in relationship to COVID and getting it, or having a worse outcome with one or the other, or susceptibility?
Well, as pulmonologists, I think, we're all very concerned about that overlap occurring, and that if somebody has the flu or somebody has COVID and gets the other virus also, their inflammatory state, their lung disease will be much worse than having one or the other. And we're very wary of this. So we do test every patient that comes in for flu and for COVID-19. If they have those symptoms, of course, and really important to identify one or the other, because if it is the common flu, we do have some therapies for that. So we want to identify that early, and we want to give those medications, and they're very different than the medications that we have right now for COVID-19. So it's really important to find those patients. So it's a real issue that we are coming up to this fall and winter season. And you want to minimize getting the flu if possible, and COVID-19.
Okay, excellent. Dr. Forangy, you want to add anything?
Sure. When you get one of these viruses, they exert similar kind of responses in the lung. And what they can do is they can damage the lining, the inner lining of the lung and the cells there. And so if you got influenza, that could kill certain cells that line the lungs. And those cells actually participate in immunity. They release antimicrobial or antibacterial peptides, which are forms of protein that can bind bacteria and help your immune system clear it out. So getting one virus could potentially make you more susceptible to the other. There's one school of thought that having had viruses can create immune responses that might overlap with other viruses. Coronavirus is not something new. Coronaviruses cause common head cold. And so they've been around for a long time. SARS coronavirus 2, otherwise known as COVID-19, is new, but other coronaviruses have been around for a long time. There is some debate out there whether having had one of these other types of coronaviruses, let's say one that's caused more of a nasal congestion kind of picture, whether the antibodies, the T cell immunity you acquired during that coronavirus may have some protection against COVID-19. Some have suggested that that may be the case. Others have debated it, but that's still an area that's under investigation.
So before I go on to another question, I'll take facilitator privilege and ask, can you get both of these infections caused by different viruses? Can you get them at the same time? And if so, what happens? Can you be, I guess there's a name for it, which I can't recall right now, dual infections.
I suppose it is conceivable you could, but here's what I think. Viruses like susceptible host. And one of the things I noticed was that, well, influenza was kind of going down and almost gone anyway. But if the one type of virus may outcompete another virus for a particular host. Now, if that host recovers, let's say from COVID-19, are they still susceptible to influenza? Yes, I would say so. They're not going to have specific immunity. But the reality is some of these susceptible hosts die. So they may never, for example, someone who is elderly, has a lot of comorbidities, they're susceptible to viral infections, be it influenza or COVID-19. It's possible that COVID-19 is able to outcompete influenza for that particular susceptible host. So that in some ways may push the influenza numbers down because the most susceptible hosts get attacked by COVID-19 and succumb to the virus. So we'll have to see how this pans out. But some of these things we'll know better with time. We really haven't had COVID-19 around while we've had influenza. Now, October, November, we're going to see the coexistence of both these viruses. And so then we'll be able to better answer these questions.
So before I go to Dr. Nolan, Dr. Weitzman, you want to make a point or ask a question? Maybe
Or
not.
I wanted to ask a couple of questions. So why should somebody be concerned about flu in a time of COVID? Could flu make your COVID more severe? How would a family decide when they would see a primary care provider?
Okay, that's 3 questions. Let's give them a chance to answer. Dr. Nolan? Dr. Nolan, you're
Yep,
muted.
yep.
Thank
I'll
you.
try to answer the last one. So when should you see your primary care doctor? So at least, when COVID first started, we told people to, kind of isolate at home if they had these symptoms, try not to expose other individuals to these things, to your potential infection with viruses. And I think that pretty much still holds true up to a point. So clearly, if you're feeling weak, if you're feeling like you can't take care of yourself, you should definitely see your primary care doctor. Nowadays, you have to call in advance and inform them of what kind of symptoms you're having, and they can usually walk you through what to do next. So if you have high fevers and you can't hydrate, those would be the kinds of things that I recommend you see your primary care doctor for early. And then if you're having great difficulty breathing, obviously, you should definitely go to your closest emergency room and if possible. And of course, if you're also able to call your primary care doctor, that would be really useful at that time. So things that would not allow you to take care of yourself. So high fever, for example, difficulty keeping food or fluids in your body. If you're having a lot of nausea, vomiting, for example, those things should definitely trigger you to call your doctor or go to your closest emergency room. And then, of course, if you can't breathe, you should go there even sooner.
So, Dr. Nolan, does that have to be, if you have some of these symptoms, would that necessarily mean it's COVID, or could it be an intense influenza?
So it could be lots of different things. It could be COVID, it could be any of the other coronaviruses, it could be enteroviruses, it could be flu viruses. There are lots of things that cause very similar symptoms. You're not going to be able to necessarily tell. There is some data out there that the loss of smell can in some ways be more specific to COVID. However, other viruses can also cause a loss of smell and taste. So it's more important to kind of identify when you can no longer take care of what you have to take care of at home and consume enough fluids and take care of yourself. And then that should trigger you going to the doctor.
Thank you. Dr. Forangy, do you want to add to that?
Well, in terms of the flu vaccine question, I say keep it simple. 2 years ago, I think it was 80,000 people died from flu in this country. Let's say everybody took the flu vaccine and that reduced mortality by 20%. You're talking about, 16,000 people living that otherwise would have died. So if everyone, compared to very few adverse side effects of actually taking the vaccine, despite, the hysterics that sometimes people, especially patients, express their concerns about, it's safe. So a simple thing like taking a shot in the arm could save tens of thousands of lives during a really bad flu season. Yet I can't get people to take it. I would say, maybe 50% of the patients agree to take it, maybe a little better. So just a simple measure. Now we have this confounding factor of COVID-19. It's going to add even more confusion and anxiety. All the more reason to take the flu vaccine to decrease the likelihood that you'll get sick with influenza, which is going to make it difficult to know whether you have influenza or COVID-19. In terms of when to see the doctor, I think if you're someone who's elderly, and I would say 60s, 70s, or 80s, diabetes, hypertension, obesity, asthma, COPD, these kind of risk factors, you probably want to know. And I think it's going to be easier than ever. They're coming out with rapid tests to give people an answer much more quickly than we had certainly in March and April. And by knowing, especially for the high risk population, that might be someone that really needs to interface with their doctor to keep on top of things, and someone who needs to be monitored. Let's say it's an elderly person living alone, maybe you're going to have a way for the family to be able to check in on that person, because some of these viruses, the clinical course is steady, and then there's a sudden deterioration. So for some patients, I think it would be very important to know. For others, it might be good to know. Maybe it changes their behavior. Maybe they would be even more motivated to avoid contact with susceptible populations, um, and to take additional precautions to prevent the transmission. The reality with COVID-19 is it looks like many of the people passing the virus are actually asymptomatic, which makes it difficult to be able to control it. And it's probably one of the reasons for that explosive exponential growth that we saw in March and April.
So thank you, Dr. Forangy. Dr. Weitzman, I'd like to ask you to comment on that same response and that same question for children. When should they see a doctor? Is it different? Are they considered the vulnerable population because they're not going to, at least from what we know now, it seems like they're not going to manifest some of these really severe symptoms. So could you add something about children and babies?
Well, the first thing is that we know that flu is more severe amongst young children than most of the population. And then there are children who are especially vulnerable to the flu. And then the second thing is that there are antiviral medications for children with the flu. It's really true that what we know so far, COVID-19 appears to be less severe in little ones, but we don't have sufficient numbers to know which of those children are most vulnerable. I would imagine that children with asthma, ex-premature babies, children who have congenital pulmonary problems like cystic fibrosis are at risk. So for me, there is the question, and all kids get sick during the winter. So when do parents get truly upset and reach out to the healthcare system? And there are diagnostic tests for H flu, for influenza, that would direct you to whether or not you made a decision to give the child antiviral medications. So it still remains for me an important decision node for parents about when they contact their child's primary care doctor and consider taking the child in. I think to err on the side of safety, it would be as soon as a child has signs of a cold, even though we know that children are going to have many colds over the course of the winter. But I'd welcome the input of Dr. Nolan or Forangy in response to that.
I was going to make a comment about going to the doctor in general, because what I've seen is an utter panic about going to the doctor. And I think people are really suffering because of this. I have to, during that 6-week period where COVID-19 was taking over the hospitals, I didn't see a single non-COVID heart attack, stroke, COPD exacerbation, alcohol withdrawal. And I can't believe that those conditions disappeared. What do I suspect? That the people had those conditions and they died at home out of fear. Either their families feared bringing them in or they feared bringing them in. Just to give you an example, I had a patient recently who came to the emergency room and she had a mass growing on her neck. And out of fear for COVID, she didn't want to come. This was being worked up in February, but then COVID hit. She didn't want to come to the healthcare system, and she just put it off. to the point where we had to put a breathing tube down, give her a week of therapy before the tumor shrunk enough that we could let her breathe on her own. So she almost asphyxiated out of her fear of COVID-19. I would say this, it is safe to come to the hospital now. It is safe to come to the doctor. Most of the medical centers in our area have made major changes to make it safer for patients to come. Waiting rooms are much less crowded. Part of that has been accomplished through the use of telemedicine and doing follow-up visits, for example, via computer instead of having everybody come back and overcrowd the waiting room. So the waiting rooms are much less crowded. People are wearing masks. Temperatures are being checked. The hospital is a very safe environment. And we're not seeing what we saw in March and April. My ICU right now, I don't believe has a single COVID patient. I think the last data I saw from Brooklyn, from all the ICUs of Brooklyn and all the hospitals in Brooklyn, the dozens and dozens of hospitals, I think there were 14 patients and 8 of them were in one hospital. So it's a different time. And I don't want patients to be so terrified of COVID-19 that they neglect their health. Things like cancer screening, staying on top of your coronary artery disease, staying on top of your asthma. All these have major impacts on health and can be the difference between life and death. So people shouldn't let fear overcome them. It's safe to go to the doctor.
So following up on that, people with asthma. So it can be it could be made worse by the flu, but also it's a risk factor for COVID. So people also get asthma during the allergy season. So let's talk about that. People with asthma, if it's caused by an allergy, I mean, should they be worried that they can also get COVID at this time? So let's talk about allergies for a minute. Many times the allergy could, as you said, as both of you said, look like an early stage of the flu or a less symptomatic COVID or coronavirus infection. So what do you think about that? What would you advise? And we know that in certain areas of Brooklyn and certainly in the Bronx, there's high incidence of asthma. So what would, Dr. Nolan, what would you say about that?
Yeah, I think everything you said is entirely true, and I would give patients the same advice I would get them that I would give them even before COVID. I would say, make sure you have an adequate supply of your medication. Make sure you know how to take your inhalers if you're on inhalers. Make sure you've discussed with your doctor an action plan that you should take if, for example, your symptoms get worse. If, for example, you have asthma or allergies or both. And then keep an open line of communication with your doctor. And I think one of the good things that's happened because of COVID, if anything good has happened, is that there are more ways to communicate with your healthcare professionals through your phone, for example, or online conferencing such as this. So there's more avenues by which patients can contact their nurse practitioners and physicians and other providers. So make sure you have your medication, make sure you know what your triggers are, make sure you try to avoid those triggers so those symptoms can stay in check, and then know exactly who to call and how to contact your doctor, and then keep extra medication available in case you can't go, in case you have difficulty getting that medication because of what is happening around you and because you're forced to stay home. And then I would agree entirely with what was said, that do not put off routine healthcare and do not put off your basic needs because of COVID, but try to find a safe way to actually perform all of those activities.
So there may be people, and I know people myself, who really don't know what viruses. In some cases, they may think that a cold is caused by the same virus that causes influenza, is the same virus causing coronavirus. or COVID-19. Could you just clearly, either Nolan or Dr. Forangy, could you just tell us about the virus that causes each one of these and the symptoms that you might look for? So a cold, influenza, and of course, COVID.
Yeah, that's part of the challenge here. It's going to be very difficult sometimes to decipher one type of virus from another just based on symptoms, because a lot of these viruses, they have overlapping complaints. So typically, the nasal congestion, the head cold, is a rhinovirus or a coronavirus, different type of coronavirus. There are type 1 coronaviruses as opposed to type 2 coronavirus. The more of the bronchitis, pneumonia, those are caused by things like influenza can cause those, but influenza can again present like a head cold, fever, chills, myalgias, and certainly SARS coronavirus 2 or COVID-19.
Excuse me, Dr. Forangy, what is Malaysia, or what did you call it?
Malaise, just feeling lousy. So all these viruses can make you febrile, have fevers, body aches, just feeling lousy. And so deciphering which is which can be very challenging to do. And again, for those that are in a high-risk category or perhaps cannot avoid contact with high-risk patients, if you do have these symptoms, it may be worthwhile to go ahead and get checked to see if you do have COVID-19. And perhaps that means you're going to have to modify your behavior accordingly. Nowadays, if people have a fever, nasal congestion, I think you should just assume in today's day and era that you have COVID-19 and take the appropriate precautions to avoid contact with others until such time you could get tested, because the risk of passing this on to susceptible patient populations, you don't want to run that risk. And if you have these kind of symptoms, it's impossible to know without testing whether it's COVID-19 or not.
So just to add to that, so it seems like perhaps a fever is maybe the deciding factor, because many of us are running around with sore throats, no other symptoms, or with a runny nose, no other symptoms. So is there one thing, I know there are many overlapping, but is there, Dr. Nolan talked about, or, loss of a sense of smell or taste, and that may or may not happen. It may not be a deciding factor. It may only happen in some people. But, if you had to say, if either one of you had to say, I don't want to be running off to test for COVID right now if my nose is running and my eyes are watering and that's all I have going on. So can either one of you comment on that?
So unfortunately, there are asymptomatic carriers of COVID. And so you can have no symptoms and still have it. But definitely if you have any symptoms of it and you're concerned enough and you identify it as a symptom, if you realize you have the sore throat, if you realize you have the itchy, watery eyes, or if you realize any of those things, then it's not unreasonable to at least try not to definitely try not to contaminate other people and then get tested as promptly as possible. So there's no way of answering that easily.
Okay. We have a comment from Dr. Weitzman. There's no reason to not contact one's primary care provider and have them help make the decision about what to do next. Thank you, Dr. Weitzman. Dr. Forangy, do you want to add something to that?
Yeah, maybe to clarify, I'll explain what not to do. And
okay.
The traditional culture, especially amongst doctors, power through it. I'm sick, I got a little bit of fever, nasal congestion, but I'll get through it. And, maybe we'd go to work wearing a mask and we won't pass. I think in today's day and era, that's not the action to take, because you're subjecting others to risk. Maybe you'll be fine with COVID-19 and recover, or perhaps you're going to get in contact with a susceptible patient. I remember it was about a year ago, I was taking care of this ARDS patient in the unit who was, I believe, a transplant patient, so immunocompromised. And he had come in, mild respiratory symptoms. He was flu negative. And then he was doing okay. And after a week or so, I forget what he was being treated for in the hospital. He actually acquired influenza in the hospital. And that's why he developed severe ARDS. So
what is ARDS?
acute respiratory distress syndrome, that's severe lung injury resulting in the need to be on a breathing machine to support your breathing. So he got this infection in the hospital. So is it possible a staff member brought that in? It's highly possible. It could have been another patient, but it's highly possible that a staff member, with that culture is, I don't want to disappoint my colleagues. They have to fill in for me. I'm going to come to work even though I'm a little sick. I think COVID-19 has completely changed the formula here. It probably should have been different beforehand, but now if one feels sick, you shouldn't be going to work, and you should be isolating yourself until either you prove it's not COVID-19 or it's been several days since you've had symptoms.
So Dr. Weitzman also brings up, there's so many options, as both of you brought up, including telemedicine and physician assistance, and even without speaking to the physician directly, that you could get the advice that you need. So since there are probably community members on this YouTube, so you have a family member who has a sore throat and watery eyes, or a sister or brother, I think I've heard what you would tell them, but what do you tell someone that's just living there and all of a sudden, their sister, their brother, their parent, them, feel uncomfortable? I guess the answer is to tell them to do a telemed, not to wait. Is that the case? Not to wait to get on it right away, or to wait till the next day and see if it goes away? Maybe it's allergies.
I think, people are going to have symptoms. The body's not going to be a constant. So a mild variation in symptoms is something to be monitored, but something surely a high fever, body aches, chills. The most concerning symptom is shortness of breath. If you're having shortness of breath, that's someone that needs to seek medical attention, because most people don't have a way of measuring their oxygen levels in-house, although now you can go to the pharmacy and buy the pulse oximeters. I think they're about $40, and you can measure your oxygen levels at home. But if you're having shortness of breath, that's something that one should be concerned about. Some of the other symptoms can probably be monitored at home, and you don't necessarily have to rush off to the doctor. It's always, if you have significant symptoms, fever, nasal congestion, and want to know if you have COVID-19, I think getting a test is not a bad idea. It can provide information and give you more information to know that I need to really change my behavior here, because I have documented evidence of this COVID-19. But for those with shortness of breath, it's a different story. That's someone that needs to seek medical attention immediately. And I think that's the more important question here. When do I need to go to the doctor right away? And certainly if you're developing shortness of breath, because I've known patients that called me and they're like, yeah, I'm starting to feel a little short of breath. And then they barely made it to the hospital because they deteriorated so quickly within such a short period of time. So shortness of breath, that's a bellwether. That's when you really need to go and be checked out.
So I'm going to turn to Dr. Nolan, but does shortness of breath occur also if you have the flu?
So it can, yeah, it absolutely can.
That's confusing.
Yeah, it's very confusing. And that's why you have to, when you're concerned enough about your health, it's not unreasonable to go get tested, because the tests can actually tell you if it's the regular flu or is it COVID-19. Not 100%, but it can usually tell us. And then the therapy, the treatment can be decided very early on. And that's when you have your best chance of getting better. So you can feel short of breath with both.
This is confusing.
Mhm.
So we have a number of questions that have come up. Michael Weitzman has just a comment. People should not have to go through this alone. Reach out to primary care with any respiratory symptoms, especially during COVID. So I think you've both made that point very strongly. Another question is, are there any updates on asymptomatic spread? Is this still a serious concern? And from what I think I heard you say, Dr. Forangy, it's still a very serious concern.
Yeah, I think I brought it up. Dr. Nolan brought it up. There was the great example of the Teddy Roosevelt, the aircraft carrier, where they had an outbreak of coronavirus. And from their investigation of that outbreak, what they realized is that most of the transmission was occurring during the asymptomatic period. And in fact, some of the viral levels are highest right before you develop symptoms. So you could see how this could spread so quickly in the community if there's really no warning that you have a high viral load and you're out there just doing your usual thing, and people were getting exposed during that period of time, because obviously if you knew that you're sick, you're going to take appropriate action to avoid contacting other people. But unfortunately, this particular virus, the cat's out of the bag by the time you develop symptoms. So it makes it really challenging.
So we have another question on that same, and then I would like to turn to Dr. Thurston to talk a little bit about indoor pollution and indoor events with COVID. We know that most of the spread and the concern is for indoors. But before I do that, there's a question: how are clusters starting and spreading? Should people who live in neighborhoods where there are clusters, should they be even more concerned? Should they take special or extra precautions? Dr. Forangy?
Clusters usually happen with people that are in close contact, usually indoors, and prolonged periods of time. As Dr. Nolan pointed out earlier, we've learned more about this virus, and it appears that the primary mode of transmission is through inhalation of respiratory droplets. So family get-togethers, parties where people are in close proximity, you're with loved ones, you're not wearing a mask, that often can provide the best opportunity for transmission. If you're living in that community and you're taking the appropriate precautions, I think you can go about your life and live safely. One thing I don't want my clinic patients to do, and I tell them this all the time, is I don't want you to spend your entire lives in the house. That's not healthy. It's not good for your health. You need to go out, get sunlight, make some vitamin D, and also for your mental health to get out. I've seen incredible anxiety, and which can have adverse effects on other components of your health. So I think for those that live in communities where COVID is present, you can go out, you can go to the grocery store, but just use common sense. Maintain social distancing, which we like to say at least 6 feet, and wear a mask, and be careful with your hands and touching your eyes and your nose and your mouth. And I think if you take simple precautions, you can go about and live your life. And I think if you do that, you're going to live a healthier life than someone that tries to become a hermit crab and live in the basement for the next 6 months.
And those are the same precautions one should take even if they have the flu, actually.
Absolutely.
Dr. Nolan, do you want to add anything to that?
Yeah, I would add frequent hand washing to that. I would say that in addition to making sure that you know what you're touching and try not to touch very many things when you're outside of your home, just frequently wash your hands. And if you don't have access to running water and soap, very often when you're outside, have some hand sanitizer. Absolutely. I would add that. Mask wearing, social distancing, and washing your hands.
Okay, so we have 5 minutes left. I want to, Dr. Thurston, hopefully you're still with us. Thank you. If you could, in like 1 minute or something, because I want to give everyone a chance to have a last point that they want to make. But your work is so involved in indoors, as is Dr. Nolan, and with environmental droplets, and you heard what Dr. Forangy added and Dr. Nolan. As an epidemiologist, what can you bring to the table on this issue?
Well, I think one of the things that I wanted to say, just having studied indoor air pollution and outdoor air pollution, is that particles in the air are, they can be toxic. They are toxic often on their own, but they're also vectors. They will pick up things in the air or in your lungs, and so you can breathe in particles, and then they can pick up the virus and then carry them out, and they can reside in the air for a while. So normally we worry about particles like from cooking without ventilation, without sufficient ventilation, and people can breathe those particles. But now those particles can carry other things like viruses, the flu or COVID possibly. And so one of the things people should think about is, well, I think, as was mentioned, going outdoors is a good option if it's possible. But to get ventilation, to open the window, to have ventilation. If you have a hood over cooking area, to turn that on and try and get as much fresh air in. Because one of the old expressions is the solution to pollution is dilution, and you can dilute this by bringing in fresh air. So I think that that's something that has a double plus to it. One is just the pollution that happens indoors anyway, from cooking and from dust around the house and from different it's people's sprays and things that we generate a lot of pollutants indoors, and you don't want to have it all encapsulated, and you want to have as much fresh air as possible. So I think there's a double benefit. Just normally it's a good idea, but now with the viruses, it's even more so.
Thank you. Thank you. So we have 3 minutes, and I'd like to ask you all, including Dr. Weitzman, Dr. Thurston, to give me a bullet point. Give me something that you would like our communities and our viewers to take home with them, a soundbite. We'll close with that. Dr. Nolan.
A soundbite: wash your hands and social distance, and try to stay healthy, eat well, and stay happy. Because if you're happy, it potentially makes you feel better also. So, and then also stay in contact with your doctors.
Thank you. Dr. Forangy.
I'm going to, my last word will be a short little story.
Okay.
We had this patient. She came for an outpatient procedure, and there was a complication, and she needed to have a tube placed. And instead of going home, she spent 2 or 3 days in the ICU. And then after 2 or 3 days, we took the tube out. And as I'm standing by the bedside and take the tube out, the first thing the patient said to me is, "None of you doctors have COVID, do you?" So I think that underlines the anxiety that's out there. This is something we should take seriously, right? COVID and all the precautions that we talked about, we can safely manage this. but people also have to keep things in perspective. Generally speaking, I would say things are getting better. They're not getting worse. When we do see patients nowadays, even the ones that get very sick, more often than not, I'm able to return them to full health. So for whatever reason, the pandemic is behaving very differently now than back in March and April. So I think it's important that people take proper precautions, but people need to live their lives to get back to their workplaces, resume economic activity, because the social isolation, the lack of employment, the financial stress that this is going to cause is going to lead to a lot of other problems. So do your part to keep COVID under control, but go out and live your lives.
Thank you. Dr. Weitzman.
Well, I agree with everything that's been said. I just would say that medicine and public health and science are remarkable contributions to the well-being of the public, and that these are unprecedented times, and that people should turn to healthcare providers for guidance about what they do. And nobody should be doing this on their own, on behalf of themselves or family members. They need to involve people who have devoted their lives to understanding these nuances. Thanks.
Dr. Thurston.
Well, I guess I would just simply say wear a mask, because it has been estimated that if everyone wore a mask, that could be as effective as if we had a vaccine. Because vaccines aren't always 100%. Not everybody takes them, and in fact, if everybody started wearing masks, would protect themselves, it would protect others, and it really is a simpler solution, and one that's available to us right now, not a year from now or 6 months from now. And I think it really could blunt the rise that we see going on right now if people would just do that one thing, in addition to spacing, social, and the things that have been mentioned before.
Thank you. So I think I'll just wrap it up with giving a point myself. And that is that I think we have to do, I think we have to take into consideration everything you've heard here, and you have to be wise, but you also have to do what you feel is right. So in addition to wearing masks, if you feel that going in to a place that there's too many people and you don't feel comfortable there, don't do it. If you feel that, certainly we have to go grocery shopping, but if there are events still being held and other people may not be wearing masks or social distancing and you don't feel it's a place for you, then don't do it. So I think we have to really listen to what's being said, pay attention, and do what feels comfortable for you. So with that said, I hope that you've gotten what you needed, what you wanted, what you were curious about, concerned about, addressed. As you could hear from all the answers, we're still living in a time of confusion. We're learning every day with scientists like Dr. Nolan, Dr. Thurston, Dr. Weitzman, Dr. Forngy, myself, that we're trying to put out information and along with all of the heads of this and all the scientists all over the country that are working on this. So please be safe, and thank you for joining. We'll be remaining on YouTube, and you can follow this link or tell it to your friends, and it will be existing for quite a while. So tune in. Thank you.
Have a good night. Bye.
Good night. Evening.